We've got a great panel coming up, and I am so honored to introduce to the audience another family that has philanthropy deeply woven into it, the family of the legendary actress Elizabeth Taylor. As many of you know, Elizabeth Taylor was one of the first and most passionate activists on the front lines of the AIDS epidemic. In 1985, she co-founded AMFAR, appearing in television commercials and testifying in front of Congress. And in 1991, using the $1 million that magazines paid for photos of her wedding to Larry Fertensky, she launched the Elizabeth Taylor AIDS Foundation to directly serve people living with HIV and AIDS. The foundation has made grants to more than 675 groups in 44 countries and remains on the forefront of HIV education, treatment, and advocacy for those affected by the disease. That is in large part due to the efforts of her own grandchildren and great-grandchildren who have taken on the mantle of her activism and the very foundation she started 26 years ago, and several of whom are fortunate to have with us here today. Before they take the stage, let's take a look back at the icon and her incredible legacy.
I'm loud, and I wear the pants in the house because somebody's got to.
From child star to ingenue,
lock the door,
to leading lady, Elizabeth Taylor was the brightest star in the world.
Hey, somebody's coming, man.
Her entire life on camera, she faced constant scrutiny. From almost losing her own life to the inconceivable loss of those closest to her. She persevered, channeling her strength into the greatest challenge she would ever face.
A rare form of cancer has triggered an epidemic. Deadly sexually transmitted.
I am here for those the world does not want to see.
I will remain here as rowdy as I have to be.
President Bush, your policy is wrong, dead wrong, and you know it.
Elizabeth Taylor shook the world into action, carrying the torch.
Because the world needs you to live.
Of a true warrior.
Please welcome Naomi Wilding, Tarquin Wilding, Quinn Tivey, Rhys Tivey, and Finn McMurray to the stage, as well as their moderator for today's discussion, an award-winning actress and activist, Judith Light.
I am very happy to be here today. Thank you very much. I want to introduce you to my new family. I am an only child, and so all of a sudden, I am not a mother, but I have now taken on all of these young people as my family. Years ago, Elizabeth Taylor was the person who really sparked my advocacy for HIV and AIDS. I had been living in a process of a lot of my friends in the theater and in film and television who were dying, and nobody was really talking about it. And I heard her speak, and I saw her activism, and I saw the brilliance with which she garnered everyone's attention. And for her, it was her service to this particular cause of HIV and AIDS that really changed the dynamics of the world. And what has transpired since then is that I have continued that advocacy for myself, using her as my inspiration and my model. And today, I want to introduce you to her grandchildren and great-grandchildren who have taken up her legacy. And so what I want to do today is I want to have a family conversation with all of them. We spoke yesterday, and I just could not tear myself away from them. So I am wanting to welcome you to this family, and so you are now part of our family. So let's begin. Naomi, I'm going to start with you, and I want to talk to each of you about what we talked about in terms of your passion and why this is so important and how you became involved.
Well, I think it's worth mentioning that our grandmother never asked us to to be a part of this foundation. It was never assumed that it would become a family foundation, that we would inherit this responsibility. We all grew up with her, watching her in awe of the work that she did. Being the younger generation in our family, we didn't really witness her as an actress. We witnessed her as an activist, as an advocate. And we were, all of us, in each of our own way, we were blown away by it. But she never, it was her responsibility. She made that very, very clear, that it was her responsibility, it was her choice, it was a personal journey for her. She gave us absolute freedom to do what we wanted with our lives. But after she passed away, I think that partly because we were so inspired by the work that she had done for HIV and AIDS, we had been inspired by her life to be of service in our own way, that it was important to fight for others, fight for justice. They were all values that she passed down to us, even though she never said, I want this to be your life, I want this to be your choice. It was just something that when the opportunity came, are you okay?
Are we all right?
Everybody okay? When the opportunity came to us, I think we all were so incredibly happy to take that on, you know, to not follow in her footsteps, because that's absolutely impossible, but to find ways unique to each of us as individuals to try to make a difference, to try to speak to those issues of social justice, to find ways to help others. I mean, in this case, we've chosen to follow in her footsteps to help people with HIV and AIDS, but most central to all of us is to find a way to be of service, and that was her message to us as we grew up.
Right, and that's the top note of all of this. Finn, you being the youngest, talk to me about your ideas about what we were talking about in terms of young people and how many people who have children now and should be concerned. The fact that HIV and AIDS is not over, there has been no cure, and that it is still relevant today, even though people are not talking about it, it's not on the front page. Please speak to that.
Well, I feel very lucky that I've had a family and a community that has been very open and supportive and informative. And through this work and through talking to my family and my peers, I've kind of noticed a disparity between the conversations about HIV, sexual health, and social justice issues surrounding HIV, which in my generation doesn't feel as present as it should be. So I've kind of got I've got to look into what's really going on in the HIV world, and then back in my own community, in my own peer group and age group, I see that that's not really being discussed and not really being talked about. So that's the main thing that got me really hooked into this work.
Do a lot of your peers know that you are a part of this organization, that it is this family that is doing this great work?
Yeah, I mean, I'm pretty open about it, and
right.
I like talking about it. I like sharing what I know, because I feel lucky to know it, and I feel that that information should be shared because it is so important. And do you think that it's the youth that need to talk to the youth about their sexual education and their sexuality, because it's something that we don't tend to talk about very much like in the very beginning of the pandemic? Absolutely. I think it's a topic, as well as sex in general, in this country, and at this point, it's not as easy, it's not as clear, and it's not talked about in the same ways as it should be. And I think for my generation, who didn't really see HIV and AIDS in the same light as earlier generations when the epidemic began,
right.
there's less conversation. It's not in the news every day. It's kind of pushed back. And so we don't see it as a current day issue, which it really is. It's a lot of the times, even in my sexual health education class, it's talked about as the past and as not something with the importance that it really holds.
And the fact that so many young people are seroconverting, they were HIV negative, and now because we're not talking about those things, they are becoming HIV positive. And so it's an issue that we really have to be paying more attention to. Tarquin, can you talk a little bit about your desire, your passion, your connection to the family?
Maybe. Hey, what's up? That's my nephew. Isn't he great? Yeah, I mean, I'm honored to be part of what I consider just to be the coolest family. I love my family. And, you know, that was part of what drew me to it. But for me, it was, I mean, it's pretty simple. I saw that there was a need to do more, that there's a need to, you know, as my grandmother saw when the epidemic was starting. And there still is a need to do more. And the fact that, you know, if people really rise up, that there's a potential end in sight. And that is just incredibly exciting. And it's hard to not be fired up by that. And then I was, you know, presented with an opportunity, which I'm so grateful that there was an opportunity for me to be of service in that way. And just my values are, you know, greatly to, or helping people means the world to me, as many of us feel, I'm sure. You know, it's nice to help people.
And it's great to do it with your family, and a family like this.
It's so cool.
I mean, it's just really,
it's cool.
Not only are you doing a great service, but you're getting to be connected to your folk. Talk a little bit about that, too. Talk about your own passion for all of this and some of the things that you have done, trips around the world. They are not only doing work here, they are also doing work globally, which I think is important.
Well, my involvement was much like Naomi said. Initially, my relationship with my grandmother was just very personal. I didn't really know very much about her activism until she had passed away and until the opportunity really arose to come forth and carry on the legacy in the small way that we are. And before that as well, I had even a peripheral understanding of her celebrity even, and really it was more kind of like a relationship of going to LA like once or twice a year and jumping in bed with pajamas and watching Law and Order. And the thing, but though now I'm beginning to make connections kind of retrospectively, that there was always this understanding that she was incredibly intimate, incredibly connected, and incredibly present and respectful of every person that came into her presence.
Totally.
No matter what their background was or any particular derivation.
She might have more fun chatting with her waiter at dinner than the senator she's sitting next to.
Yeah, for sure. Depending on the energy, she just was so down to connect.
Yeah.
And that was another thing is that, so that was one thing, was that she was never going to let supposed prejudice, you know, get in the way of connecting with somebody. And that was like the unifying theme that I see has held over from her personality and her legacy into the HIV and AIDS community, that there's this incredible unifying force. We went to AIDS Watch in March, as we did in DC, where constituents from all over the country come, just regular people of all races and all ages and all orientations. And it's incredible to look at this huge room, people preparing to lobby on Congress, of people of all backgrounds coming to see. You see that unifying force that, you know, sex is something that is amazing. It's this connecting, creative mode of expression, and it's not just about having babies. and so that's
it's
unifying. You know, it's not. Yeah. So that's.
Oh my God.
So that's unifying because it gives us it requires us.
What else is it about?
It requires us.
We're not going to go there. That's another discussion group that we'll be having later.
So on the one hand, it means that we're all vulnerable to it.
Sure.
To HIV and AIDS.
Of course.
But on the other hand, it requires us to celebrate and honor diversity because there are discrepancies of access because of income disparities as well as healthcare access. So there's a unifying force and there's a celebration of diversity in HIV and AIDS. And I see that now looking back in my relationship with my grandmother, that she embodied that in this really incredible way.
Yeah, and
she was raunchy as all.
She was. She had a mouth on her that was so fabulous. I mean, and that's part of what drew everyone to her. And of course, you know, all of you have that experience of her. But now that I want to talk about your connection to this too, but I also want you to talk about the issue of how you are funding all of this great work that you guys are doing with Grandma not being here now. How do we do that? And let's include that in what you want to talk about in relation to her.
Okay. Do you want me to start with how I got started?
Start with whatever you want.
Well, much like my brother and my cousin Naomi said, Bed and Law and Order, really raunchy girl advice, hanging out eating PB&Js, that was Grandma, not the celebrity. But after she passed, I think was an opportunity to do more research into the public side of her life, really,
right.
To be frank. And right away, got completely impassioned to get involved with her foundation specifically, chomping at the heels of the trustees at the time, until there was an infrastructure in place, including a new managing director to pick up where she left off. And we actually, a month before he started, he invited me to breakfast, and we sat down and had a few pleasantries and then looked each other in the eye and said, all right, I got some ideas. And they were all the exact same ideas.
Oh my.
And we just hit it off like that, and everybody has been involved since then as much as we can be. But with respect to how it's been operating after she's passed, she had such amazing foresight that she set up her trust in such a way that it's able to cover operating expenses. And for example, within that, I'll do a little shameless plug with Mother's Day coming up, a portion of all proceeds from White Diamonds goes to support the foundation. So watch out for your moms. But what that also means is that any donation we get is 100% to programming. And we're one of very few people that can say that we can tell you exactly where that dollar is going.
Almost impossible. I mean, for anybody who knows about or reads Charity Navigator.
Yes.
That's right.
Yes. So we're very proud of that. But we're also very proud of partnerships that we've been able to establish over the years.
Yeah, tell me some about that.
They're international and they're national. On the national front, in the South, in America, where, for example, nearly half of HIV diagnoses are taking place in the South, Southeast, we've created a partnership with the Elton John AIDS Foundation. Right. So we're serving areas that are otherwise, frankly, within this country, being left behind.
Right.
But also internationally, we're really excited, and actually this isn't public yet, but I'll share it here, which is that we've just solidified a partnership with the UN Foundation Nothing But Nets campaign to integrate malaria testing and treatment services with our mobile healthcare clinics in Malawi, which is really exciting because it means we're able to take like a 360 approach and integrate holistically a number of different healthcare services with HIV services, with other services that require great need in the area. And we're able to be really successful at that. Actually, we've done amazing stuff in Malawi over the last few years.
Yeah, tell me more how you're operating globally, because I think that's important for everybody to know about as well.
Yeah, absolutely. With respect to Malawi specifically, we started providing mobile health care clinics there in 2008. But in 2012, we noticed that we were only testing one man for every 5 women that we were testing, clearly speaking to sexism, stigma, cultural discrepancies going on between males and females. But we began developing, with our implementing partners on the ground, Gaia, a number of interventions that, to this day, that stat is now down to 1 to 1.6.
Oh my.
Yeah, and we are at the cusp of achieving, if anybody's familiar with UNAIDS idea of 90-90-90, it's essentially get 90% of the world's population tested, 90% on treatment, and then 90% sticking to treatment, which means that then they could become virally suppressed and not transmit HIV.
And this is also for our security here in this country, which we don't talk enough about in relation to HIV and AIDS.
Absolutely. I mean, I'll wrap out Malawi to say we're almost there. And if we can do it in one of the most rural and most marginalized and arguably poorest places in the world, we can do it anywhere. But right here at home in the US, we're talking about 13 to 29-year-olds being at the highest risk of new infections. And I'm not comfortable with that, speaking to the future of our own country.
Exactly.
And we're talking about gay or bisexual black men being statistically poised to be 1 out of 2 of them getting HIV.
Right.
So, I mean, how does that even make sense? And what social situations allow for that?
And that's some of the work that you guys are doing, and you're going to make a mark on that, I'm sure.
Absolutely.
And what I also think is important to say, and I know we're almost out of time, I want to know if there's any, one of the things that I want to say particularly with this group in this city at this time, that because we don't have HIV and AIDS and people are not dying every week, and we're not going to funerals every week, this is still one of our biggest health issues that we have to deal with. And I don't want to just say across the globe, I want to say here, right now, in this town, we have to make sure that we're taking care of our young people and everyone, but really our young people, our children, who are poised to be in a situation where they might be open to getting HIV and AIDS, and I think that's something that's really important to know about, and that's the work that you're doing. Anything else that you guys want to say?
Can I add that it's not just a health issue?
Sure.
You know, because we do actually have so much amazing medical advances now that with the 1990 campaign, we need to apply that at home, because what's preventing people from getting tested and getting on treatment and staying on treatment is discrimination and stigma. It's more than anything, I think we really want to shine a light on that idea, and comprehensive sexual education comes into that too. That idea that we need to educate each other, not just about the risks of the virus, but we need to educate each other to be more tolerant, to be free to get tested, to come out, to be free to be yourselves, to be loving, tolerant individuals that support each other within our community. If we can find that, and we can find a situation where people are getting tested and getting on treatment, it's at home, it's so much to do with discrimination and stigma, even right here where we feel like we've come so far.
Yeah.
Can I say to that point, now more than ever in this political climate, there is so much responsibility on the individual to be able to take that position, on private foundations, corporate partners, to be able to step up where we might be failed in other arenas, and to be able to responsibly take that on and to talk within your communities, talk to your representatives, and figure out creative and innovative ways that we can fill gaps that might not otherwise be supported.
Yes.
And really effective ways. Finn, Quinn, and me went to Malawi this summer, and one of the most amazing things to witness about the programs, the mobile health clinic programs in Malawi, is that they're extremely community-oriented, and that it's about helping people really help themselves and have the resources to be able to have a sustainability in their approach.
Right. Well, we do have to wrap up, but I just wanted to say that because you are family, you are making the rest of the human race your family, and I think that's what's so remarkable about you. And I cannot think of a more extraordinary family to extend itself to this family at Town and Country, and to also know that your grandmother, who is your great-grandmother also, who is absolutely looking down, would be so infinitely proud.
Well, it's an amazing honor to be here. Thank you to Town and Country.
Thank you. Thank you very, very much.
Thank you, Judith.